COVID's grim patchwork. Delhi's main Muslim cemetery for victims of the pandemic is almost full. India is in the grip of a surging epidemic. Cases have passed 200,000 a day, a spike driven in part by a new mutated version of the virus. It's already spreading across borders. New figures from Public Health England show there have been 77 cases in the UK. Scientists say the evolution of the variant is an inevitable consequence of India's infection rate.
The more transmission you get, the more people that are infected, the more variants you'll get. It really is that straightforward.
The Indian variant, called B1617, has two key mutations in its spike protein. The first is called L452R, which is also found in a variant circulating in California, although the Indian virus has evolved independently. The second is called E484Q, a completely new mutation. Lab tests suggest both help the virus infect cells and evade antibodies. And while it's still unknown what real-world effect that would have on vaccines, the combination gives it the hallmark of a dangerous virus. Public Health England is tracing contacts of those infected, as it also steps up surge testing for the South African variant. Another 56 cases have been detected in the UK in the last week, bringing the total to 600. In South London, where public health teams are dealing with a cluster of cases, people are still coming forward for testing, some still planning to meet friends this weekend.
We're still planning to go out, but thought it's the best thing, I guess, to come and get tested after hearing everything on the news.
People are just going out regularly, so I'm a bit worried about the spread of the new disease.
A little scared, I think, possibly. But what can we do? We try and be sensible.
The spread of variants brought into the UK has led to renewed criticism of the government's travel controls. India is not on the red list of countries with travel bans and hotel quarantines. Instead, people are trusted to stay at home. It just doesn't work, says this expert.
This year, we have to be just incredibly strict and do what New Zealand and Australia do, and do every person comes in has to do 10-day managed hotel isolation. Particularly as we're rolling out the vaccination. We have put all of our eggs in the vaccine basket. The vaccines work brilliantly well. And the one thing that could be a potential risk to that is a new variant that can overcome the protection from vaccines.
Boris Johnson is due to visit India later this month, despite the accelerating epidemic. Downing Street said safety is paramount and the Prime Minister will follow any quarantine rules on his return. It added that the red list of countries is under constant review. Thomas Moore, Sky News.